And thanks for joining us. We're getting closer and closer to distributing COVID vaccines, but there's still a lot of work left to sort out.
We do have team coverage tonight. Brady Mallory shares what Dane County's role will be, but we're going to begin with Naomi Coles on how the governor is looking to prioritize Wisconsin, and specifically its 500,000 healthcare workers. Naomi?
Charlotte, the governor estimates that Wisconsin is going to need $10 million to distribute this vaccine just between January and March. First in line, of course, are Wisconsin's 450,000 healthcare workers. Hospitals like SSM Health here behind me are working to finalize their plans to get vaccines to their employees. Simply getting the freezers to store the vaccine was a challenge.
The Pfizer vaccine has to be stored in ultra-cold freezers at minus 70 degrees Celsius.
Now, SSM Health is figuring out how to get the vaccines to all of its hospitals.
Distribute the vaccine to smaller sites is another issue of packing the vaccine correctly and appropriately, sending it to the appropriate location. Once we get it out of the freezer, we will want to make sure that our vaccination sites are ready as the vaccine arrives, because the clock is ticking. We need to give the vaccine within that short period of time.
SSM Health expects to be ready by mid-December, when the first doses should arrive in the state.
It's going to be quite an operation here to try to vaccinate all employees over a short period of time.
They have more than 10,000 of them, and it's just one healthcare system out of many getting first dibs.
We also have an imminent need to be prioritized to receive vaccine shipments.
Fueled by state legislative inaction and surging case counts, the governor has asked the U.S. Department of Health to put Wisconsin high on its distribution list. State health leaders don't yet know how long it will take for healthcare workers alone to get it, because we don't yet know how large weekly shipments will be. But no one will have to get it.
Decisions around taking the vaccine are individual decisions and the decision of that particular employer.
Wisconsin law allows employers to require a vaccine with disability and religious exemptions.
What's interesting is both of those categories have been construed fairly narrowly.
A labor attorney who represents businesses around the state is hearing from clients that many will likely encourage rather than require it. But if so, employees that object could have a hard time in court.
And I think that the analysis is going to be different in a world where we've got COVID. I think a court might, give an employer more latitude to require it.
Ultimately, talking to people in healthcare, the vaccine on the horizon brings a sigh of relief.
We can see the light now at the end of the tunnel.
Neither SSM Health or Unity Point Meritor plans to make this vaccine mandatory yet. Talking to other healthcare systems in the area, UW Health isn't yet ready to share their plans for distribution. Meritor tells me that they plan to prioritize employees who have high exposure to COVID-19 first. They also have all the equipment they need right now to get that vaccine plan going. Meanwhile, Brady Mallory is over covering Dane County's plans for distribution. Brady?
Well, it's a question a lot of people are asking. How will I even get those shots? Well, there is a system, but Dane County Public Health's role is actually fairly small. Public Health doesn't actually distribute the vaccine. That'll be up to the state and healthcare providers. Once first-tier people, such as healthcare workers, get the vaccine, the state will need to hire a mass vaccinator. Whoever that ends up being will work to get vaccines to the general public. The state also needs to develop software to track the distribution.
Those two items are yet to be put in place, but we have time. We have time. There's the first tier would probably be starting in the next couple weeks, and wouldn't probably be finishing until maybe the middle or end of January, and then we'll start looking at the next tier.
Fagley says public health departments have had a little practice in mass vaccinations, like H1N1, for instance, so they're ready to step up if the state needs help. Of course, this effort will be much longer and possibly take several months. You may eventually see drive-up lanes at the Alliant Energy Center change from COVID testing into vaccination spots, but that's only if needed.